Namaste everyone, I am Dr. Vishvanath S. I am working as an endocrinologist at Apollo Medical Center, Marathahalli. Today I am here to educate regarding the good oral hygiene that has to be maintained among patients living with type 2 diabetes. We all know that type 2 diabetes itself is a chronic inflammatory status, and also a patient who has uncontrolled sugar will feel excessive thirst and also will have a dry mouth. This will lead to infection of the gingiva, that is nothing but the gums of your teeth, because once there is dryness, there is easy for the bacteria to enter into the gum and cause infection, and once that infection sets in, it will be there for longer period duration, and that causes chronic gingivitis. And in a patient with diabetes, chronic gingivitis itself will lead to uncontrolled diabetes per se as well. It is also shown that a patient with type 2 diabetes, whenever he has a chronic gingivitis, it can predispose to cardiovascular disease, although it's not proven, but that's a known risk factor as well. So we should be aware how to keep our oral hygiene. You can keep your diabetes under control, especially HbA1c of 6.5 to 7.5 depending on the age of the patient and also depending on the underlying complications as well. So to prevent this dryness of mouth, it is advised for the type 2 diabetes patient to consume frequent water in a recommended fashion way to quench the thirst as well as to rinse the mouth as well. And brushing twice a day is also recommended by dentists for the same cause. So it prevents your gingival infection, and it's good for your gingival health as well. So I would recommend people living with type 2 diabetes to manage their glycemic control, to keep the HbA1c under check of at least 6.5, 7.5 depending on the age of the patient and the underlying complications, so as to prevent the other complications including micro and macrovascular complications, and one of the most neglected complication, that is your chronic gingivitis and your oral hygiene. So suppose a patient living with type 2 diabetes comes with has a history of bad breath, or maybe sore mouth, or maybe irritation in his gums, will have to contact a endocrinologist in consultation with your dentist as well, so as to work up together and prevent the complication. Thank you.